Next, we're here on Good Day Connecticut this Wednesday. We're talking about a weight loss procedure at a local hospital. It involves a balloon, and it could be the tool that some people need to achieve the weight loss that they're looking for.
Well, one thing is a constant when it comes to extreme weight loss. Changing your lifestyle is always the first and the best choice. But if diet and exercise just aren't working for you, I'm happy to say you do have more surgical options now than you've ever had before. And I'm not even sure this is really considered surgical, but one of the newest is called the ORBERA Intragastric Balloon, and Bristol Hospital has it. I'm happy to have joining me now bariatric and minimally invasive surgeon Dr. Souheil Adra joining me now. A pleasure to meet you, sir.
Pleasure being here.
Glad to have you here. The first thing I noticed when I picked this up was, yeah, you're right, it was cold and it feels, it's very firm. But so how does this work? How are we getting this inside somebody?
So essentially you start off with a deflated form of the balloon. You place it endoscopically. So just like doing a colonoscopy, you'll be sleeping for this. And what happens with this is that you place it inside the stomach and then you inflate it with saline.
Blow it up.
Okay. Exactly. And
well, there we go. We're looking at video of how it works. Yeah. It just sort of travels down.
Yep.
And we blow it up.
You got it.
Okay. What's the benefit as opposed to other ways of having bariatric surgery? We were talking before. There's a lap band, the Roux-en-Y procedure. There's a whole bunch of them. What sets this apart, doctor?
Well, this is one of the advantages that you don't actually have to undergo surgery. There's no cutting involved. You just do an endoscopy and you place it. It's a time-limited procedure, so you only leave the balloon for so long. 6 months is the time that you would leave it in. Okay. So it has an added benefit to diet and exercise, and it will help you lose more weight. That said, surgery does provide you with long-term, weight loss and treatment for that. But the advantage of having the balloon is that it addresses people that would not qualify for surgery otherwise. Ah,
okay. Now, who does qualify for the balloon specifically?
So if you actually know, for the BMI is a way to measure how your weight relates to your height. So typically for surgery, as you can see with the graph, people that actually usually would qualify for surgery, you would have to have a BMI above 40 if you have no other medical problems, or above 35 if you have medical problems. The balloon actually, you would be able to place it in people between a BMI of 30 and 40. Okay. So those people, a lot of them do not qualify for surgery.
So that's wonderful. So this is actually a first option for a lot of people who didn't have them before.
You got it.
All right. How about insurance? Is this so new that it's not covered yet?
It's not covered by the insurances yet. Yeah.
Okay.
So it is self-pay, but it comes as a program where you include both the placement or removal of the balloon as well as dietary counseling for a year.
Okay.
So, and follow-up for a year with that.
That's fairly standard procedure, though, that you have to have the counseling to go along with this, that it's not just one and done, right?
Exactly, and that's why when you're a part of a bariatric center, I mean, you already said, this is not surgery, why am I doing that procedure? Essentially what it is that you end up with performing this as a component, as a tool, as part of a comprehensive approach to weight loss.
Okay, mechanically, how does this work? We put this, it would be like right in the stomach. Is it just giving your stomach a feeling that it's full, which disinhibits wanting to eat?
The details of the mechanism are not extremely elucidated, but some of the theories are that it gives you some more restriction. So it's occupying some space in your stomach, so it gives you a feeling that your stomach has something in it. That's one. The other thing is that it actually may slow down the emptying of your stomach.
Oh, okay. All right. So that would, I guess, almost like fiber, help make you feel like you're full a little longer?
A bit better than fiber, obviously. I mean, this is about 600 cc's in the balloon, so that's about 2 cups of water.
Yeah. Yeah, I guess, just sort of holding it up is the best way to do it. It's very sort of bouncy. I almost feel like it's at risk for breaking, but I'm sure it's not, right?
It's made of very tough silicone coating, so it actually is a resilient balloon. The other thing is that this is one of the reasons why we have to remove it at 6 months, because if you left it longer, it could potentially run the risk of eroding or actually deflating.
Yeah, because and
then it could migrate. That's one of the issues.
A problem. Can you do it a second time, maybe afterwards? Do we know that yet?
Well, we know about this procedure has been done more than 10 years outside the U.S.
Okay.
And we know from the outside the U.S. experience that typically that's what they do. They remove the balloon, they place another one. The FDA did not approve that use.
Not yet.
Not yet.
Do you expect it's coming, or is that something that you don't think the FDA is ever going to get into?
It's hard to tell. I think the FDA is waiting for more data from the American, the studies to come up, and I think that once we have that, we probably will see those approved.
Lastly, because we're almost out of time, 6 months, how much success can you have with this procedure and with all the accompanying dietary restrictions and the counseling? How much success can somebody hope to achieve?
So the data that we have has shown that you get about 10% of your weight off at 6 months. At 1 year, you regain some because the balloon is out, but you're continuing with the counseling, you get to about 7.5% of your total weight loss. So this is significantly much improved over diet and exercise.
Yes, and of course, given the fact that they don't have to, sorry to be crude, just slice and dice you up like a lot of the other procedures are that work, this is a much more attractive option. So once again, Bristol Hospital is who has it, and Dr. Adra is one of the surgeons who helps perform it. Thank you so much for being here. A pleasure to have you.
Thank you.
Okay, still ahead on Fox 61's Good Day Connecticut. We're going to talk